News.
It's been a very active flu season, according to the Centers for Disease Control. So far this year has been worse than last year. But now we're getting our first look at how well the flu vaccine's been working this season. CBS 2's Elise Preston has more.
The Centers for Disease Control and Prevention says this year's flu vaccine is providing substantial protective benefit, especially for children. Flu vaccines are reducing doctor visits related to flu by 45% overall, 55% in children, according to preliminary estimates.
The season has been more severe in children than in previous seasons, and that may have to do with the type of influenza that's circulating. Influenza B can be more severe in children.
Flu vaccine effectiveness typically ranges from 40 to 60%. This season got off to an early and unusual start, with flu B viruses dominating, and now a second wave of flu A H1N1 is hitting. So far, the vaccine appears to be less effective against H1N1 for younger adults. In the U.S., there have been at least 26 million illnesses, 250,000 hospitalizations, and 14,000 deaths from flu so far this season.
Doctors stress if you haven't already, it's still not too late to get a flu shot because the season is far from over.
Right now, the map of the United States looks pretty red, and that means that there's a lot of flu activity. Most of the areas have the highest level of flu activity that we see during a season.
And it's worth a reminder, wash your hands, cover your cough and sneeze, and stay home when you're sick to avoid spreading the virus. Elise Preston, CBS News, New York.
The two strains of flu circulating this season tend not to be as dangerous to the elderly.